America is one of the richest countries in the world, and yet we're going through a healthcare crisis. Per a 2021 study by Gallup, roughly one-fifth of Americans are unable to afford health care. Healthcare is a right that every American should have regardless of their income because it's integral to our success as a nation. Historically, we know that our healthcare system has been around quite a while, since roughly the 1920s. Meanwhile, other major countries such as Canada and the UK have had their universal healthcare since the late 1940s due to post-reconstructive efforts of World War II. Per U.S. News, our healthcare escalated to a breaking point amidst COVID-19 and demonstrate how ineffective our system is. But with universal healthcare, which will be abbreviated to UHC for brevity from this speech, we can have a positive healthcare system. Because it would improve public health, it would reduce the cost of healthcare for all of us, you and me, and it would cultivate the economy. Based on my research, universal healthcare is a right that universal healthcare is crucial because it would vastly improve public health through ease of access. It will reduce the cost of healthcare for all with cessation of premiums and deductibles. And it will cultivate economic productivity through a healthy workforce. Universal healthcare will vastly improve ease of access, public health through ease of access to every American. Per Gale, researchers at Harvard concluded a study in which 45,000 Americans die annually due to inaccessible health care. This evidence asserts that these deaths could have been stopped if universal health care had been implemented. The study also responds to details of healthcare rationing, in which people who can't afford the healthcare simply go without, and then they succumb to their illness. Universal healthcare responds to this issue. Per an article by the APHA, ease of access would also improve the racial disparities seen within our private insurance-based system. During COVID, it was seen that 20% of all counties in this country are predominantly black, and those counties account for 58% of all COVID deaths. The hospitals in these areas receive less than half of the federal funding of their counterparts, amidst the people of color in these areas already having less access to doctors and clinics. Universal health care would also reduce the cost of health care for all Americans with the cessation of premiums and deductibles. Per U.S. News, the reason our health care is so expensive is because it is ran. People's well-being and pharmaceutical needs are ran as a for-profit corporation. U.S. News also states that Yelp performed a study in which it was seen that there were plans that would save 13% or $450 billion annually through national healthcare expenditures with the implementation of universal healthcare. UCSF also did several studies in which there were multiple plans who would immediately net a 3.5% annual savings, and then other plans would eventually save that, if not more, through years of implementation. Universal health care would also reduce the cost of health care for all businesses, small businesses, excuse me. Per U.S. News, unburdened small businesses would increase capitalism while encouraging entrepreneurship and innovation. They also state that this would allow for personal growth, as people would no longer be tethered to jobs strictly for its benefits. Universal health care would also cultivate economic productivity through a healthy workforce. There are numerous studies corroborating that healthy employees are more productive. Per a WellSteps article, neglecting employees' health results in sick pay, compensation costs, and insurance claims. Per Resources also conveys that healthy employees are typically retained, which keeps their knowledge on the job and also keeps the company from having to pay to onboard new employees. The economic stimulation would offset costs from UHC, because having a healthier workforce inherently means businesses would generate more revenue and income because they have more active employees. Per a Globe Newswire article, illness-related lost productivity costs are roughly $530 billion per year after companies have already paid $880 billion for healthcare benefits. In conclusion, universal health care is a necessity all Americans require because it would vastly improve public health through ease of access. It will reduce the cost of health care for all through the cessation of premiums and deductibles, and will cultivate economic productivity through a healthy workforce. If we continue down this path, we only hurt ourselves because this system fails the most vulnerable purely out of financial exploitation. Our healthcare system has become enamored with the almighty dollar, and it only hurts, and it has now become cruel for those in need.